and welcome to today's Podiatry Today webinar. Today's presentation is New Innovations in Remote Patient Monitoring to Help Reduce Foot Complications. My name is Emmy McCauley, a Managing Editor for the Wound Care Learning Network, and we're happy to have you joining us today. We'd like to thank Orpyx for sponsoring today's presentation. During the webinar, feel free to submit questions and comments for our speakers by using the question submission section on your screen. At the end of the presentation, we'll try to answer as many of your questions as we can in the time allowed. Today, we are very pleased to welcome our featured speaker, Dr. Matthew Garoufalis and Dr. Jeffrey Lehrman. Dr. Garoufalis is a podiatrist certified by the American Board of Podiatric Surgery and American Board of Podiatric Orthopedics and Primary Podiatric Medicine, and a fellow of the American Society for Laser Medicine and Surgery. He is also a certified wound specialist by the Academy of Wound Management. He has authored many articles and has lectured extensively across the country on a variety of topics pertinent to podiatric medicine and surgery and practice management. Dr. Lehrman is a podiatrist in private practice in Fort Collins, Colorado, and operates Lehrman Consulting, LLC. He is a diplomat of the American Board of Foot and Ankle Surgery, a fellow of the American Society of Podiatric Surgeons, and has been honored with a designation of Master by the American Professional Wound Care Association. Dr. Lehrman is also a certified professional coder and certified professional medical auditor. We are very happy to have them join us today. And with that, I will turn it over to our presenters, and I want to thank you again for joining us.
Thank you, Emmy, for that kind introduction, and welcome to those of you who have joined us. This session will focus in on the nightmare of neuropathic ulcers. And we will start by talking about some of the very scary incidence and prevalence numbers associated with neuropathic ulcers, the fact that those are actually getting worse, and we will focus on our need to shift our attention from attempting to treat these ulcers to instead attempting to prevent these ulcers. And that will lead us to our discussion of pressure and the very important role that pressure plays in the development of these neuropathic ulcers, and how important it is that we, who are attempting to prevent these ulcers, focus in on pressure and our ability to monitor pressure and our ability to prevent pressure, and the fact that preventing pressure prevents diabetic foot ulcers. This will lead us to our discussion of the Orpyx SI sensory insole, which many of us have already had good success with, and we get to introduce, for the first time ever in a formal setting, the Orpyx SI Flex sensory insole, which is a newer option that does not require a DME, durable medical equipment license, and does not require that we jump through the hoops associated with the diabetic shoe and insert program. We start with some of these awful, scary statistics regarding diabetes, peripheral neuropathy, and neuropathic foot ulcers. The numbers are crazy. When we start talking about millions and hundreds of millions of people, I think it's hard to even wrap our head around numbers like that. But we can, I think, wrap our head around the very simple statement that one out of three people in North America are either diabetic or pre-diabetic. Doing these kinds of talks even 10 years ago, that number was 1 out of 4. It's now 1 out of 3. So I think about this when we're in a big public setting, like a shopping mall or an airport or something, and you look around, 1 out of 3 of those people in North America are either diabetic or pre-diabetic. And 70% of people with diabetes will develop peripheral neuropathy, so very common among those that have diabetes. And then the number one cause of non-traumatic lower limb amputation is that diabetic peripheral neuropathy. I'm going to repeat that one. I think that's an important statistic. Number one cause of non-traumatic lower limb amputation is the diabetic peripheral neuropathy that we are talking about here. And make no mistake, this absolutely does lead to ulceration and amputation. And I suggest a lot of people watching this may already know that 25% of people with diabetes develop foot ulcers, but then we can talk about the recurrence rate after a diabetic foot ulcer heals. So our healing rates aren't great to begin with, but even among those that heal, even when we get it healed, a great percentage of the time, even that is not good enough, because 49% of healed diabetic foot ulcers recur within 1 year. That's certainly opinion and experience, but more importantly, this is all peer-reviewed literature. You can see we have references on all of these facts that we're sharing here. This is peer-reviewed literature. That's about half, right? It's fair to say half. If we say 49%, half of diabetic foot ulcers that heal recur within 1 year. And if we get past 1 year, by the time we get to 5 years, if the patient has lived that long, 68% of diabetic foot ulcers will recur within 5 years. 68% recur within 5 years. And that, of course, contributes to this very high amputation rate. This is the cycle that we need to break. This is the madness that I think it's fair to say all of us have been experiencing our entire careers, and we must do better than this. We owe it to our patients to do better than this, to our communities, frankly, to our oath to do better than these awful statistics. This is a pictorial version of what we were just looking at, starting at the top at 12 o'clock. There's the ulcer. If we get it healed at 3 o'clock, and then we enter that remission stage at the bottom, where a lot of us have trying to be careful with maybe even not even using the word healed, because given these extraordinarily high recurrence rates, it may be more appropriate to refer to that as a remission stage, and then the nightmare of reulceration, where I think it warrants repeating, about half the time reulceration occurs within 1 year, and 68% of the time, if the patient's still alive at 5 years, it has recurred within 5 years. And that's the cycle that it is so important that we need to break. And all of those awful statistics contribute to mortality. So here's our 5-year mortality rate of diabetic foot ulcers. You can see that with the foot there. And then look at the minor amputations, the first dark colored rectangle there. The very high 5-year mortality rate of minor amputations, higher than all cancers' 5-year mortality rates pooled. So to be clear, what we're talking about here with the 5-year mortality rate is the percentage of patients that will die within 5 years of developing a diabetic foot ulcer, within 5 years of a minor amputation. These numbers are so high, higher than breast cancer, prostate cancer, and with the minor amputation number being higher than all cancers pooled together, that 5-year survival rate. And you might think, because I do, well, these people are sick. The people that get diabetic foot ulcers are sick. The people that have a minor amputation are ill, a lot of comorbid conditions. Maybe there's something else contributing to their death. And that may be true. However, make no mistake, there is significant morbidity and mortality associated with the ulcer itself and our repeated attempts and failures to treat these ulcers. We, frankly, put these people through a really hard time coming into clinic over and over, debridement over and over, hospitalizations, amputations, whittling away. They get overwhelmed with antibiotic in many situations. And all of this absolutely takes its toll and does contribute to this extraordinarily high 5-year mortality rate. But there's good news. So we spent the first couple minutes here with a lot of troubling news and troubling statistics. There's good news. There is something we can do about this. We've demonstrated the literature that by the time the ulcer develops, in many cases, it's too late. What if we could shift this whole thing upstream, and instead of devoting our attention to healing, which we've seen the success rates are not great, and even when we do succeed, the recurrence rate is extraordinarily high, instead shift our attention to preventing the ulcer. And we do now have the ability to do that by using physiologic data that we can monitor and track have that communicated to the patient, have that communicated to us. And the good news here is that the technology that every single one of us is carrying in our pocket and has been for around 10 years, maybe more, is now available in our treatment of diabetic patients with peripheral neuropathy as far as trying to preventing these. We now have very powerful information that we can use, embracing the technology that's available to help us try to prevent these diabetic neuropathic ulcers. And the Orpyx SI sensory insole system gives us the ability to track pressure, temperature, and utilization, adherence. Are they wearing these inserts? Are they using them? How many hours a day do they have them in? Do they have them in when they're walking? That's that last element there. So it's important to consider what we are monitoring. So we said, this is great. We have new technology that allows us to monitor things, but what we monitor matters. And temperature is useful. However, temperature is a late stage indicator. And we'll mention this a couple times, that too often, by the time the temperature is elevated, too often by the time we have the ability to detect an elevated temperature, it's too late. And the inflammatory process has already begun. Ulcer development is already underway. And then we are reacting to that rather than staying in the prevention mode, which is why it's so important to point out again, the Orpyx SI sensory insole system gives us the ability to monitor, yes, temperature, but also behavior, adherence with the product, and pressure. And we said at the beginning, pressure is the cause of plantar diabetic foot ulcers. Pressure is the culprit. You think of diabetic foot ulcers, why do people develop a diabetic foot ulcer? Well, it's not only because they have diabetes. It's not only because they're immunocompromised with compromised skin integrity and small vessel disease. Because where do these happen, right? Where do diabetic foot ulcers develop? Sub 1, sub 5, sub 2 if it's a plantar flex second metatarsal, plantar heel, plantar midfoot in a midfoot collapse situation. That's where they happen, right? And why are they happening there? Why do patients get them there? Because that's where the pressure is. So pressure is the causative factor in the development of plantar ulcers among people that have diabetes. So that's what makes it so important to monitor not just temperature, but also pressure and utilization, if the people are using the devices at all. And if we can identify pressure, and if we can reduce pressure, that's what leads to prevention of these diabetic foot ulcers. Preventing pressure prevents diabetic foot ulcers. It does not take a lot. It does not take a lot of pressure to really make a difference. And you can see here, even very low amounts of sustained pressure can lead to tissue ischemia, inflammation in the area, and eventually breakdown of the area that is experiencing that pressure. And what we're using now, most of us, or maybe I should say what we have been using traditionally, doesn't give us the ability to monitor pressure. We give somebody an old diabetic shoe that we were using 6-7 years ago with just a regular old Plastizote Insote with no type of smart technology. We're not detecting pressure. We're not monitoring pressure. But now, like I said, we have all this amazing technology in our everyday lives to see this now in our clinical lives and to marry this with our attempts to provide better care to our patients is really exciting. And this works. And yes, everything we're talking about here actually works and is effective in reducing diabetic foot ulceration development. This is not just experience, not just opinion, but more importantly, supported by randomized control trial data. This is a well-renowned, peer-reviewed international journal demonstrating that the Orpyx technology resulted in an 86% reduction in ulceration when patients wore them for more than 4.5 hours per day. So we can talk about the monitoring the pressure and what we can detect and communicating with the patients. More powerful than anything is a randomized control trial demonstrating that this reduces diabetic foot ulcers by 86%. So we go back to those numbers that we started with and think if we can, from the beginning, reduce the occurrence of ulceration by 86%, what does that mean for morbidity and mortality and amputations and all the things that follow the development of the ulcer? And with this data, the Orpyx technology is the only, it's an important sentence, really powerful to be able to say the only plantar pressure and temperature monitoring system that is backed by level 1 randomized control trial data. 86% reduction in ulceration with the Orpyx technology. And temperature is important also, and that certainly plays a role in what we're doing and in our monitoring, and the Orpyx technology allows for that as well. However, temperature alone is not good enough. Temperature alone is not good enough. Temperature, we said we would mention this a couple times, temperature is a late stage indicator. By the time the temperature is increased, we already have inflammation and already have tissue damage either present or developing underneath. That's why the temperature is elevated. So temperature alone is a late stage indicator, and why it's so important to combine the monitoring of temperature with the monitoring of pressure. And the third element that Orpyx allows us to monitor is utilization. Does the patient have it in their shoes? We can get all this great data, and that's very nice, but doesn't help us at all if the patient's not wearing it. So if we go through a day where there are 0 alerts and no concern is raised, it's also important to know, well, how many hours was the patient wearing it? Because if we got 0 alerts because they wore them for 0 hours, that doesn't help us very much. So having this information allows us to provide feedback to the patient, to encourage them to follow the protocol, to encourage positive behaviors, allow us to provide feedback based on the patient's utilization, and give us the perspective that we need to interpret the data that we are looking at. I think a lot of us, and maybe I shouldn't project onto the audience, so I'll say it can be frustrating as a provider when we talk about compliance. The patients don't listen. They don't do what I tell them to do. They're not compliant with the recommendations. Well, I challenge that we should ask ourselves, are we giving them the tools that they need to be compliant? Are we even giving them a chance? This is a giant step toward compliance. So instead of being frustrated with the challenges that we experience with compliance, giving them tools that help them to be compliant can be so powerful. And this feedback helps to encourage positive behaviors and helps us to appropriately direct these people. And that is so important because the education tools that we are using right now are not working, which I suggest is one of the reasons why these failure rates are so high and why outcomes are so poor in this world of diabetic foot ulcers. Again, this is, I'm sure many of you will shake your heads and say, oh yeah, that makes sense. But this is peer-reviewed literature, not just opinion or what somebody thinks. And it's kind of frustrating to read it at first. And I found it to be discouraging, quite frankly. However, I think it's important that we recognize this, thereby recognizing we need more than what we're doing. So just explaining this situation to the patient, explaining morbidity, mortality, discussing what we want them to do. Patient gets to their car. By the time they get to their car or on the bus, they have forgotten 80% of what we've said. HCP stands for healthcare provider there. They've forgotten 80% of what we've said. So now they've remembered 20% of what we said, and it gets worse. Of the 20% that they actually do remember, half of that is wrong. They've mixed it up. You think of like a whisper down the lane game that you might play with friends where things get messed up as you think about it. They only remember 20% of what we say. Half of that is incorrectly remembered. So by the time we get done with this, they only have 10% of the information we tried to share accurately retained, which is why using a system like this that allows that feedback, communication, feedback that can help to impact their behaviors, another reason why it's so important. And before we transition to Dr. Garoufalis here, one more comment on the importance of what we monitor. That temperature alone isn't good enough. And we spent some time talking about the importance of pressure, that it is the causative factor in diabetic foot ulcers, that it does not take much to initiate tissue damage. And the good thing about monitoring pressure is when we detect increased pressure, we're still in that preventative stage. Look at the left-hand slide, the left-hand side of this slide. When we detect that pressure early, we're still in the window of opportunity to prevent. Whereas if the only thing we're monitoring is temperature, by the time we detect that increased temperature, now we're reacting to a process that has already begun. So we've mentioned Orpyx SI several times here. Dr. Garoufalis is now going to get into the details of the Orpyx SI offerings and formally introduce the Orpyx SI Flex sensory insoles.
Thanks, Dr. Lehrman, for that, for starting us off here and giving us some great background to go forward. I want to talk to all of you about remote patient monitoring and how we use that to help our patients, because let's face it, it's here. We are going to be using this in our practice more and more and in so many different ways going forward. So let's not resist it. Let's learn about it, because we are helping our patients, and we're going to help our practice too, but let's talk about it and see where we go with this. So let's look at remote patient monitoring and look at some of the provider benefits right off the bat. We have this data that we're collecting through daily activities. As the patients do their normal routine, we're collecting data, which is really awesome. When we have this data, it helps us to predict patient outcomes and possibly alter treatment effectiveness based on what the patient is doing or not, because we're collecting this data. It allows us then to have great communication with our patients because we understand better what they're doing every day. So the patient also becomes very proactive versus very reactive about their treatment. Dr. Lehrman just went over a little bit of that, but this data that we have at our fingertips is very dynamic and it's right on time. It's happening now. As a result, it allows us to use the healthcare resources that we have at our disposal much more effectively because we know exactly what's going on. And best of all, these patients are engaged in their healthcare. And we all know that when we can engage our patients in their healthcare, we're going to get better outcomes, which is exactly what we want. So talking about patient benefits, in 2016, there were about 7 million patients that used remote patient monitoring. In 2020, it had jumped up to 23 million patients that were using remote patient monitoring. The projection in just a couple more years is well over 30 million patients using remote patient monitoring. So it's here, and more patients are going to be exposed to it because this gives them more control over their personal health, which is amazing, which is exactly what we want. Okay, so let's look at the products that we have available to us. The Orpyx SI custom insert is what's available right now. And this technology has been used for many years. I've been using it myself for several years as it has been modified and upgraded to the point where it is now. It's currently available to up to 8.5 million patients. But what's really interesting, what's fascinating, and what I'm excited to announce to all of you, the Orpyx SI Flex is coming in just a couple months. What's neat about this is that you don't need a DME license to use this. This is more like an off-the-shelf prefabricated insert using this incredible technology. With this, we can then use it on even more patients that have a variety of different types of neuropathy. So I'll get into that a little bit more as we go forward. But the most important thing here is that the Orpyx SI Custom goes along with your DME license. The Orpyx SI Flex is a prefabricated off-the-shelf product that anyone can dispense to their patients and allows for greater use, but you still get the monitoring effects, which is fantastic, which is exactly what we want. So let's look at this technology a little bit closer. So we see it's a layered product. This is the Orpyx SI custom insert. This is the one that we use with our DME license. We see the multi-density top layer that reduces friction and provides us a little cushioning with the EVA foam. This is compliant with HCPCS A5514, which is really important. In the middle layer, we have the sensor technology, and you can see all the little sensors that are in that layer. The bottom layer is, again, EVA, so a little bit more cushioning. It gives us the durability when we place this inside the shoe. And of course, these inserts come with that wireless charger that you just drop into the back of the shoe in the evening, and you just need to do it a couple times a week, and you'll get plenty of power to get the data transferred for these inserts. Let's go ahead now and look a little bit more at the Orpyx SI Flex. And it's a very thin insert, prefabricated, dispensed based on shoe size, just like all the other prefabricated orthotics we have. However, this one has that remarkable technology to give us information about pressure and temperature. So it's very thin. You don't need the DME license for this, and all you need is the patient's shoe size, and you can dispense this technology to your patients. How remarkable is that? So we have this sensory system. We have real-world data that we're collecting for daily activities that we get back on our computers that we can now look at and understand what that patient is doing every day. The patient can interact with this and have a better understanding and a better comprehension of what they need to do differently and how their activities affect themselves. So we have in this the interactive mode. What's really nice about this is the new feature is going to be the do not disturb mode. For those patients that don't need the interactive mode, they can put it on do not disturb and go about their daily activities. And when they come back home, all that information that this insert has collected during the day is then downloaded into the system, and we can see what kind of activity was undertaken. And if there was anything alarming, we know it right then and there, and we can make adjustments. So this is really very patient friendly. We still have the interactive mode, so the patient can actually carry this device with them and visualize what's going on at the very moment it's happening and still get their alerts. However, we also now have the do not disturb mode. They can leave the device at home, not be bothered with the alerts, and when they come back, all the data that they've collected in the insert during the day will be downloaded for them. So what's really wonderful, here's what the patient would see if they're looking at the activity live. which is really great. And this is no setup is needed. This just happens when you get the insert. And you can see on the right the kind of information that we're going to get, the total alerts that happened, time in the safe zone, which is really important. It's a step counter also. And one thing that we want to see is how long did they really use these inserts? Again, Dr. Lehrman spoke about patient adherence. Wow, we can see that. That's right on the data sheet for us. So that's vitally important. So what's beautiful about this is that we can change behavior immediately. If the patient gets an alert, there's certain instructions that are given to the patient in order to help them alleviate the increased pressure that they see on their screen. So you can see some of the options that are available here, such as sitting down, inspect your shoes, inspect your feet. These are the screens that occur when there's a real-time alert given. So we get immediate feedback to the patient, and this goes into the platform so that we can see these alerts as well. So it's really a remarkable system. So we have these two options that will be available to us. We have the Orpyx SI Custom, which we have available now. And then we have the new product that's coming to us, the Orpyx SI Flex, which is the off-the-shelf product. And here we've been able to outline some of the differences and similarities between the two and when they should be used. Now think about your patients that have neuropathy but are not necessarily diabetic. There's alcohol neuropathy, there's neuropathy from chemo. There's all sorts of reasons why a patient can develop neuropathy that aren't tied to diabetes. The new Orpyx Flex inserts are exactly what we can give them to help them monitor that neuropathy so that they too don't have to undergo the difficulty with ulcerations. So we've seen that the commonalities of the Orpyx Flex, moderate risk foot complications, patient needs preventative care, but they're not yet ready for custom insoles. They can be switched between most daily footwear. And I mean, these are really thin and they are very easy to slip in and out of shoes. They fit all kinds of different types of shoes because they're so thin. They fit into dress shoes, into gym shoes. So they really fit a variety of different shoes. All you need, it's very simple to order the Flex because you just need the prescription and the shoe size. That's it. Some of the commonalities between the two of these is, of course, they're also indicated for high-risk foot complications. And what's really nice for your practice, it allows you to use the RPM CPT codes, which Dr. Lehrman is going to go over shortly. So not only with the custom do you get to use the remote patient monitoring CPT codes, but you also get to use them for the Orpyx Flex inserts. So it's like a win-win both ways here. Now, of course, the custom inserts go along with the HCPCS A5514, and those we need to be scanned in order to order those so we get all the proper accommodations of that patient's diabetic foot. And you do need a DME license for the Orpyx custom inserts. So with that, I'm going to hand it back to Dr. Lehrman now, and he's going to take it the rest of the way and talk about some coding issues as well.
Orpyx really has made this seamless for us. I think it's fair to say when we first started many years ago with remote physiologic monitoring, it felt a little clunky and it was new to our practices and may have been difficult for some to incorporate. Those days are over because Orpyx has developed what really is a turnkey solution to help us participate this from beginning to end, starting with this patient outreach program where Orpyx really does partner with us and our staff to help us with patient enrollment. All we need to do as the practitioner is identify the patient. And once we identify the patient and say, this patient needs this, this is medically necessary for this patient, Orpyx will take it from there. and facilitate the enrollment process, removing any burden from us and our staff. And this part is available using the Orpyx SI Flex. Then, once they're enrolled, Orpyx has what they refer to as the Best Foot Forward program, where every patient is provided with continuous, personalized, one-on-one education and support. And then finally, the monitoring. And Dr. Garoufalis mentioned this. We are going to get to the CPT coding and the profits that are associated with this. That final, very important piece is the remote physiologic monitoring. And the means by which Orpyx allows this is truly comprehensive, and it is turnkey, not requiring a tremendous amount of time by us on our staff because of the assistance provided by Orpyx. And Orpyx provides us with these phenomenal reports regarding, again, pressure, temperature, and adherence, because we're getting to CPT codes. And when CPT codes are submitted, there are associated documentation requirements. So oftentimes in talking about these remote physiologic monitoring codes over the last couple of years, since they were first introduced, the question has been, okay, I get the codes. Well, what documentation do I need? That's one area where these phenomenal, clean, easy to read reports are so helpful. One, of course, is that it helps us to provide the service to our patients. We want the reports to help us see, well, what does this mean? What were the results? What were the alerts? The reports are very clean and easy to read, and it helps us provide that feedback to our patients, but they also help us really almost do the whole thing, satisfy the documentation requirements associated with this program. We have CPT codes coming up on the next slide here. When the question is, well, what documentation do I need? Here it is. It really is all that is provided from the Orpyx system. And this can be incorporated into the patient's electronic health record, or if it's a paper chart, there's a way to do it that way too. If you're still using paper charts, this gives us the documentation that we need. And with whatever additions are needed from the practitioner, we have compliant documentation that allows us to provide the service in an effective manner and to satisfy any requirements associated with the submission of those CPT codes. So we purposely spent the majority of this time talking about how great this is for patients, how great this is for our practices, why it's so important clinically, preventing ulceration recurrence. But it doesn't hurt to note that this is also a profitable endeavor, handsomely profitable at that. If you are not already aware, there are CPT codes associated with remote physiologic monitoring. And I think of this as 3 different steps of coding and we're going to go through each of these, with 99453 being the first step, CPT 99454 being the second step, and then CPT 99457 and 458 associated with the third step. So let's go through these 3 steps. When we initially set up the Orpyx SI insert and give it to the patient and provide them with the education on how to use it, the programming, what to do about alerts, all of that setup and education is represented by CPT 99453. So that's, again, the initial setup and providing that education, explaining what we're doing, what the alerts mean, how to interact with the technology, and providing that education to the patient. That's a one-time code submission. Then we have CPT 99454. This is submitted monthly for every month that we provide the transmission of the recordings, for every month that we provide the transmission. So for every month that we provide that service to the patient, we submit CPT 99454. So you can think of the product, I think of the device sort of like our smartphones. That's a one-time deal. But the phone itself, with no service coming in or out of it, is useless, right? We also need the monthly service. So for the Orpyx SI sensory insole, we have the product code, which represents the actual insert. But in the slide that Dr. Garoufalis showed earlier with the different components of this, there's also the technology in there, right? Beyond just the A5514 insert, we have the technology embedded in there, and that's what the education is tied to. That's what the CPT 99453 is associated with. The 454 for the monthly monitoring, for the monthly transmission, and then we have the monthly monitoring represented by CPT 99457. So this is for when we perform the monitoring for at least 16 days. This represents the first 20 minutes of monitoring, and at least one live interactive communication with the patient is required. Now, you may ask, well, what if we go beyond 20 minutes in that month? That's where CPT 99458 comes into play, which is an add-on code which can be used in addition to CPT 99457. If we exceed the first 20 minutes, then we have CPT 99458 to represent each additional 20 minutes of monitoring. Not only does this provide better outcomes, reduce recurrence of diabetic foot ulcers, we demonstrated the peer-reviewed literature to prove that, improve outcomes for our patients, improve our practices, result in profits for us that we just showed, this is also cost effective to the payer. So I suggest rare situation in healthcare where patient wins, practitioner wins, and even the third-party payers are happy with this, which seems to be one of the reasons why they've embraced this so much. This reduces costs. This is a cost-effective solution. So both short-term and long-term decrease in events, but look at the reduction in cost. So when we consider the cost of the product, the cost of providing the monitoring, compared with the costs associated with prevention, right? Think about the cost of an average diabetic foot infection admission, and the studies and the imaging and the vascular work, and tremendous savings associated with prevention of diabetic foot ulcers. So yes, this is a cost-effective solution really embraced by the third-party payers. As we come to our conclusion here, please note that we have left a lot of time for Q&A. We did that for a reason. We did that with intent. Dr. Garoufalis and I hope that you are generous with your questions and you feel comfortable submitting a lot of questions, which is one of the reasons why we've left so much time here. I assure you, there is no such thing as a silly question. And maybe I was thinking of the coding when I said that, but that applies to any of this. And there are a lot of people watching this, both now and on demand after the fact. If you have the question, chances are excellent someone else watching this has the same question. So you're not only going to get your own question answered, you're going to help a colleague as well. So we invite you to please submit questions, and we're happy to entertain those when we're done. Here to wrap up, we talked about the nightmare of diabetic neuropathic ulcers, the prevalence, the fact that they're increasing, the very scary morbidity and mortality associated with them, the fact that what we're currently doing is not working. The success rate in healing these is poor. The recurrence rate is incredibly high. And we talked about how important it is to monitor, to use the technology we now have available, to monitor the parameters we have available to us, and the most important of those being pressure, and how the Orpyx technology allows us to monitor pressure, temperature, and adherence. Dr. Garoufalis talked about both the Orpyx SI sensory insole and the Orpyx SI flex sensory insoles, and the new Orpyx SI sensory flex does not require a DME license, does not require us jumping through the hoops associated with the diabetic shoe program. And we had that side-by-side chart that compared the two. We now have both options available to us. And finally, There is CPT coding associated with this so that this is a profitable endeavor for our practices. On behalf of Dr. Garoufalis, thank you for your attention, and we look forward to interacting during the following Q&A session. And thank you once again for attending this session. We're now live. Jeff Lehrman, Dr. Matt Garoufalis also, and we are now excited to take your questions. To repeat what's already been said, please feel free to enter your questions. You can see we left lots of time for questions, and we hope that you will fill that time with questions. We already have a bunch that have come in. Don't be bashful, and please feel comfortable submitting more. The first question, and Dr. Garoufalis, I'll start with this and see if you want to add anything. Okay. The first question, and I'll read this word for word. Are you saying if we stop pressure events that we can stop ulcers from forming? Yes, that's exactly what we said. Forgive me for repeating what I said during the formal content, but when you think about where diabetic foot ulcers form most commonly, they're in areas of pressure, right? Plantar first metatarsal head, plantar fifth metatarsal head, areas of pressure. People with diabetes or poorly controlled diabetes don't just spontaneously open holes in their feet, right? There is an element of pressure there, which is why we spent so much time talking about the importance of monitoring pressure. And to repeat, Orpyx sensory insoles are the only product of this nature that provides sensory technology that monitors pressure. Dr. Garoufalis, do you want to add anything to that?
Well, I couldn't agree more. It's pressure is the culprit for these diabetic foot ulcers. And if we can recognize it and control it, all of a sudden we have fewer diabetic foot ulcers because of that. So it's really the key to taking care of the problem before it actually starts. So yeah, this is part of that routine. Control the pressure, we control the ulceration.
The next question is, how much do the insoles cost? Again, I'll start with that one, Dr. Garoufalis. That was more in the stuff that I covered. That's going to vary a bit based on where you are and your purchasing agreement. The bottom line is, if you reach out to your Orpyx representation, they can help you with exact costs for you and your region and with whatever purchasing agreement you have. And if we didn't share it already, you can find that information at orpyx.com. That's ORPYX.com. And that's where you can get information about purchasing. They can also help you with reimbursement rates, which also may differ a bit based on where you are in the country, getting you, instead of national averages, exactly what the numbers are for your area. In addition to pressure, I'm reading the next question. In addition to pressure, doesn't elevated shear force strain on plantar structures cause tissue ischemia? Let me reread that. I think I enunciated the wrong words. In addition to pressure, doesn't elevated shear force strain on plantar structures cause tissue ischemia? It does, which is one of the reasons why it's important to point out that pressure is a indicator of elevated pressure shear. So when pressure is elevated, that is an indicator that there's elevated pressure shear as well, which again goes back to the first question that we had, why it's so important to monitor pressure. One, because of what we've already talked about with pressure, but also thank you to whoever typed this in, recognizing that pressure is also an indicator of shear. Before I read the second part of that, Dr. Garoufalis, do you want to comment on that?
Well, I couldn't agree more. You know, when there's pressure, you're also getting shear. Does it specifically measure shear all by itself? It doesn't measure shear all by itself, but it does measure the pressure, which when we have an increase in pressure, we can legitimately assume that shear is involved in this. So we have to take action.
And the follow-up here, I think we may have already answered this. If so, does this insole help identify those areas of shear? Which, yes, is the answer. I think we addressed that Dr. Garoufalis, do you want to add?
Yes, it does. It does tell us where there is shear because it tells us where there is pressure. There cannot be shear if there is no pressure. So where there is pressure, there is in all likelihood shear also. And these give us that information so that we can take the appropriate precautions.
And the next question, I'm going to answer this one first too, because this was one of my slides. What is the evidence supporting this device? So we covered this during the presentation, so apologies to those that may have already heard this. We talked about a randomized, and this is really important, so I don't mind the question or repeating it. Randomized controlled trial published in a peer-reviewed journal demonstrating an 86% reduction in ulceration by patients who wore the smart insoles for 4.5 hours per day. And you might say, well, what about the people that didn't wear it 4.5 hours a day? When you account for all of the patients in that study, even those that didn't meet the 4.5 hours per day, it was a 71% reduction in ulceration. So we're certainly not advocating for not wearing them as much as you should, but even when you don't reach 4.5 hours a day, which isn't even that much, it's still a remarkable decrease in ulceration rate. What diagnosis codes, I'm reading the next question here, what diagnosis codes are required to have these devices covered? What was the question that was entered? So this is a really important point that applies to all services that we provide. It's a question I get a lot in the coding education that I provide, and I can't stress this enough. There is no such thing as an official list that says these diagnosis codes work for these CPT codes. There's no such thing. There might be lists of suggestions, but I think oftentimes providers are under the impression that we have CPT code X. There's a list of ICD-10 codes that make that CPT code payable. That's not how it works. So having said that, the answer to this question is, just like any other service we provide, use the diagnosis code that represents the diagnosis that has led you to provide this service. So if it's diabetes with PAD, use that diagnosis code. If it's diabetes with neuropathy, use that diagnosis code. If it's just straight neuropathy, one of the G neuropathy codes that start with the letter G, use that code. So the answer is use the diagnosis code that reflects the diagnosis that has led to your decision to provide the service, which is the recommendation for any diagnosis coding question. How many inserts can a patient get approved by CMS per year? Dr. Garoufalis, I'm going to answer this for the custom, and then maybe you can follow with a comment on the flex and the fact that we don't have to worry about this part for the flex. So how many inserts can a patient get approved by CMS per year? So we covered in that formal content of this event that there's now two options, one being the custom Orpyx SI sensory insole, the other being the flex option, where the flex doesn't require going through DME and any coding with that. As for the custom, that is assigned the code of A5514, just like the non-smart custom insoles, and the same guidelines apply to this as apply to that, which are 3 pair per year. 3 pair per year. And then Dr. Garoufalis, if you want to pick up on a comment about the flex there.
Sure. The flex is an off-the-shelf insert that is given to the patient just based on shoe size and as often as you're willing to distribute them. So it makes it very easy. It's quite a remarkable device for something that is off the shelf, giving you that kind of feedback and that data. It's really remarkable. I think that once we start using them in that manner, we're going to get very accustomed to having that feedback, and it's going to be very valuable for our patients.
Does pressure increase measured by Orpyx SI correlate with increased weight bearing under an area? Does pressure increase that's detected by the Orpyx products correlate with increased weight bearing under that area? Yes, that's what we're saying. There's an increase in pressure in that area, very likely related to weight bearing, of course. And that's a sign that that's a problem area and an area that we need to offload. So yes is the answer to that. Dr. Garoufalis, want to add anything?
Let me give you an example. The way I interpret that question, if you're wearing the custom insoles and you're climbing a ladder, you're going to see the rungs of that ladder as high pressure areas on your readout. So yes, that's exactly what it's supposed to measure. So that's exactly how it works.
The next question here is, can the inserts be reimbursed by submitting a HCPCS code? Yes. So at the risk of repeating, the two different products that we talked about here, the custom and the flex, the Orpyx SI custom insoles have been assigned a code by the PDAC, that code being A5514. And when all requirements are met, that is reimbursable. The flex insoles are not. I think there's potential advantages there also, though, in that, I know we said this during the presentation, you don't need a DME license. You don't have to jump through the hoops of the diabetic shoe program and paperwork and all those other things. We have time for one more. And Dr. Garoufalis, I'm going to ask you to take this one.
Okay.
What made you decide to use these sensory insoles instead of the temperature mat or socks that monitor temperature?
Well, I think we said it right in the way the question was asked. These measure pressure. There is nothing else out there that measures pressure. It measures temperature also, but the fact that it measures pressure and it's dynamic, you can actually see on the device the footsteps you're taking and how the pressure transfers across the bottom of your foot with every step. It measures pressure. And this is the primary determinant on whether or not that patient will develop a diabetic foot ulcer. Pressure happens first, then temperature happens later. So if we can discover that there's a pressure problem early, we can nip it in the bud before we even get to an elevation in temperature. So these are very unique in that way.
We have about 30 seconds left, so I'll do this one really quickly. Have any commercial insurance companies adopted payment for the insoles and remote physiologic monitoring? Yes. There are commercial companies that have, just like any other service we provide. The most thorough path is to pre-authorize services for non-Medicare third-party payers. As we approach the end of our hour here, thank you so much for your attention. Thank you for attending this event. Orpyx is happy to engage with anybody that has any questions, get you more specific information, and you can learn more and contact Orpyx representatives at orpyx.com, ORPYX.com.
Thanks, everybody. Thanks for listening.